This is Chapter 3 of the Mental Health ATI, Effective Communication. Communication is a complex process of sending, receiving, and comprehending messages between two or more people. It is a dynamic and ongoing process that creates a unique experience between the participants. Communicating effectively is a skill that the nurse develops. Nurses use communication when providing care to establish relationships, demonstrate caring, obtain information, and assist with changing behaviors. Foundational to the nurse-client relationship is therapeutic communication. Basic communication, levels of communication. Interpersonal communication is communication that occurs within an individual, also identified as self-talk. This occurs when within oneself and is the internal discussion that takes place when the individual is thinking thoughts and not outwardly verbalizing them. In nursing, interprofessional communication allows nurses to perform a self-assessment of their values or beliefs prior to caring for a client whose diagnosis can trigger an emotional response. Interpersonal communication that occurs one-on-one with another individual. In nursing, interpersonal communication is used when the nurse obtains a psychosocial history from a client or when listening to a client discuss their feelings. Small group communication that occurs between two or more people in a small group. In nursing, a small group communication allows the nurse to discuss a change in the client's behavior with the healthcare team or discuss concerns with clients during a group therapy session. Public communication that occurs within large groups of people. In nursing, this commonly occurs during educational endeavors where the nurse is teaching a large group of individuals. For example, the nurse can teach about suicide prevention with high school students at a school assembly. Verbal communication, vocabulary. These are words that are used to communicate either a written or spoken message. Limited vocabulary or speaking a language other than English can make it difficult for the nurse to communicate with the client. Use of medical jargon can decrease client understanding. Denotative and connotative meaning. When communicating, participants must share meanings. Words that have multiple meanings can cause miscommunication if they are interpreted differently. Clarity and brevity. The shortest, simplest communication is usually most effective. The client can have difficulty understanding communication that is long and complex. Timing and relevance. Knowing when to communicate allows the receiver to be more attentive to the message. Communicating with a client who is impaired or distracted will make it difficult for the nurse to convey the message. Pacing. The rate of speech can communicate a meaning to the receiver. Speaking rapidly can communicate the impression that the nurse is in a rush and does not have time for the client. Intonation. The tone of voice can communicate a variety of feelings. The nurse can communicate feelings, acceptance, judgment, and dislike through the tone of voice. Nonverbal communication. Nurses should be aware of how they communicate nonverbally. The nurse should assess the client's nonverbal communications for the meaning being conveyed, remembering that culture impacts interpretation. Nonverbal communication can have more impact on the message compared to the verbal words. It is important for the nurse to consider how emotions like anger, depression, and anxiety may express as an incongruency for the client experiencing a mental illness. The nurse should reassess mood and clarify if they are unsure how a client is feeling. Attention to the following behaviors is important as it is compared to the verbal message being conveyed. Appearance, posture, gait, facial expressions, eye contact, gestures, sounds, territoriality, personal space, silence. The nurse should never use verbal techniques to clarify client emotions and monitor client behavior for the following nonverbal cues. Affect, frowning, lack of expression, grimacing, pursed lips, raised or lowered eyebrows, biting, licking, or smacking lips, nose scrunching. Appearance, sudden disrobing, clothing that is incongruent to current temperature, disheveled grooming. Autonomic response, visible brow or palm perspiration, pupil dilation, facial flushing or paleness, increased respirations. Body behaviors, gait, posture, hand clenching, rocking, psychomotor agitation, eye movement, suspicious squinting, open with minimal blinking. Therapeutic communication. Therapeutic communication is the purposeful use of communication to build and maintain helping relationships with clients, families, and significant others. Therapeutic communication is essential when caring for a client who has a mental health disorder because of the emotional as well as the physical effects of the disorder on the client. The nurse uses interactive, purposeful communication skills to elicit and attend to the client's thoughts, feelings, concerns, and needs, express empathy and genuine concern for the client and family's issues, obtain information and give feedback about the client's condition, intervene to promote functional behavior and effective interpersonal relationships, evaluate the client's progress towards goals and outcomes. Children and older adults frequently require adapted techniques to enhance communication. Effective use of nursing process depends on therapeutic communication between the nurse and the client's family, and the interprofessional team. Characteristics: client-centered, not social or reciprocal, purposeful, planned, and goals-directed. Essential components: time, plan for and allow adequate time to communicate. Clients who have certain mental health disorders, major depressive disorder, or schizophrenia can require a longer period of time to respond to questions. Attending behaviors or active listening. These are nonverbal means of conveying interest in another. Eye contact typically conveys interest and respect, but varies by situation and culture. Body language and posture can demonstrate level of comfort and ease. Vocal quality enhances rapport and emphasizes particular topics or issues. Verbal tracking provides feedback by restating or summarizing a client's statements. Caring attitude. Show concern and facilitate an emotional connection with the client and the client's family. Honesty. Be open, direct, truthful, and sincere. Trust. Demonstrate reliability without doubt or question. Empathy. Convey an objective awareness and understanding of feelings, emotions, and behaviors of others, including trying to envision what it must be like to be in the position of the client and the client's family. Non-judgmental attitude. This is a display of acceptance that will encourage open, honest communication. The nursing process. Assessment. Assess verbal and nonverbal communication needs. Identify any cultural considerations that can impact communication, the use of eye contact or perception of personal space or touch. Assess for congruency between the verbal and nonverbal message. Consider the client's developmental level and how communication should be adapted during the assessment phase. Children. Use simple, straightforward language. Be aware of own nonverbal messages, as children are sensitive to nonverbal communication. Enhance communication by being at the child's eye level. Incorporate play and interactions. Be aware of the child's level of development. Responses may be concrete until abstract thinking is developed. Adolescence. Determine how the adolescent perceives the mental health diagnosis. Is the adolescent at risk for refusal of treatment due to desire to be normal? Identify if the mental health diagnosis affects the client's relationship with their peers or their ability to explore their identity. Older adult clients. Recognize that the client might require amplification. Minimize distractions and face the client when speaking. Allow plenty of time for the client to respond. When impaired communication is assessed, ask for input from caregivers or family to determine the extent of the deficits and how best to communicate. Planning. Minimize distractions. Provide for privacy. Identify mutually agreed upon client outcomes. Set priorities according to the client's needs. Plan for adequate time for interventions. Implementation. Explain the purpose of writing notes or recording notes into an electronic health record at the beginning of the interview. Establish a trusting nurse-client relationship. The client feels more at ease during the implementation phase once a helping relationship is established. Reiterate the client's right to privacy and confidentiality. Explain exceptions to confidentiality. Diversity, equity, and inclusion, DEI, are essential qualities that a nurse considers when building rapport in the professional nurse-client relationship. Provide empathetic responses and explanations to the client by using observations and providing hope, humor, and information. Manipulate the environment to decrease distractions. If in a private area, ensure accessibility to help in case of an emergency. Bias-free language. Focus on relevant characteristics. Acknowledge relevant differences that do exist. Acknowledge people's humanity. What pronouns do you prefer? Avoid false hierarchies. Careful use of the word normal. Effective communication skills and techniques. Silence. Silence allows time for meaningful reflection. Active listening. The nurse is able to hear, observe, and understand what the client communicates and to provide feedback. Questions. Questions allow the nurse to obtain specific or additional information from the client. Open-ended questions facilitates spontaneous responses and interactive discussion. Close-ended questions, helpful if used sparingly during the initial interaction to obtain specific data. Avoid using repeated closed-ended questions, which can block further communication. Projective questions. Uses what if or similar questions to assist clients in exploring feelings and to gain greater understanding of problems and possible solutions. Presupposition questions. Explores the client's life goals or motivations by presenting a hypothetical situation in which the client no longer has the mental health disorder. Clarifying techniques. This technique is used to determine if the message received was accurate. Restating. Use the client's exact words. Reflecting. Directs the focus back to the client in order for the client to examine their feelings. Paraphrasing. Restates the client's feelings and thoughts for the client to confirm what has been communicating. Exploring. Allows the nurse to gather more information regarding important topics mentioned by the client. Offering general leads, broad opening statements. This encourages the client to determine where the communication can start and to continue talking. Showing acceptance and recognition. This technique acknowledges the nurse's interest and non-judgmental attitude. Focusing. This technique helps the client to concentrate on what is important. Giving information. This technique provides detail that the client might need for decision making. Presenting reality. This technique is used to help the client focus on what is actually happening and to dispel delusions, hallucinations, or faulty beliefs. Summarizing. Summarizing emphasizes important points and reviews what has been discussed. Offering self. Use of this technique demonstrates a willingness to spend time with the client, indicates to the client that the nurse has genuine concern. Touch. If appropriate, therapeutic touch communicates caring and can provide comfort to the client. Seating. A client experiencing manifestations of hyperactivity or increased anxiety may have difficulties in communicating while sitting. Consider walking around the room or in unit to improve communication adherence. Motivational interviewing. A style of communication that assists clients in developing motivation to resolve insecurities and ambivalent feelings towards behavior change. Barriers to effective communication. Asking irrelevant personal questions. Offering personal opinions. Giving advice. Giving false reassurance. Minimizing feelings. Changing the topic. Asking why questions. Offering value judgments. Excessive questioning. Rapid questioning. Giving approval or disapproval. A charge nurse is conducting a class on therapeutic communication with a group of newly licensed nurses. Which of the following aspects of communication should the nurse identify as a component of verbal communication? Intonation. A nurse in a mental health practitioner's office is communicating with the client. The client states, "I can't sleep, I stay up all night." The nurse responds, "You are having difficulty sleeping?" Which of the following therapeutic communication techniques is a nurse demonstrating? Restating. A nurse is talking with the caregiver of a child who has demonstrated recent changes in behavior and mood. When the caregiver of the child asks the nurse for reassurance about their child's condition, which of the following responses should the nurse make? I understand your concern. Let's discuss what concerns you specifically. A nurse is communicating with a client who was admitted for treatment of a substance use disorder. Which of the following communication techniques should the nurse identify as a barrier to therapeutic communication? Offering advice.